Hey guys, welcome back to my channel. I'm here to finally do the video on brain aneurysms and talk to you guys about my experiences and the journey we went through with my dad being sick and passing away from having a brain aneurysm. So I'm just happy I'm finally sitting down to talk to you guys about it. I gotta get my papers all together. I should have did this before I started, but anyways, I wrote down separately on paper my experiences, and then I wrote down a whole bunch of notes that I found offline just so that I can tell you guys exactly what it's all about. So what I'm going to do is I'm going to read off of the paper first and explain to you guys what a brain aneurysm is. And then as I go, I'm going to read off all of what I wrote down. And as I go, I'm going to include like my experiences about that certain thing. And I'm going to also read what's on my papers about my experiences and stuff like that. So I'm going to get started because I don't really know how long this video is going to be. And I only have, I'd say, like 20-30 minutes to really get this done so that I don't have any noise because my nephew is here. So I'm going to start reading and explain to you guys what it is. So it says, think of a weak spot in a balloon and how it feels stretched out and thin. A brain aneurysm is like that. It's a weak spot in the wall of a blood vessel inside of the brain. The area of the blood vessel gets worn out from constant blood flow and bulges out, almost like a bubble. It can grow to the size of a small berry. Although brain aneurysms sound alarming, most don't cause symptoms or health problems. You can enjoy a long life without ever realizing that you have a brain aneurysm. But in rare cases, aneurysms can grow big, leak, or explode, bleeding in the brain, known as hemorrhage. Stroke is very serious and requires urgent medical care. So my dad's, before I start on the rest of it, my dad's aneurysm was like towards like the middle front of his brain, and when they found out he had one, he had it for a whole entire week, but where he had his aneurysm, the bleeding where it was, it like something blocked the blood from flowing throughout his brain, because if it would have like flew throughout his brain, he wouldn't have made it as long as he did. He wouldn't have made it the week. So on to this section. The section is a ruptured brain aneurysm can be life-threatening and lead to these main things. It can lead to cerebral vasospasms, reduced blood flow to the brain is what that is. Hydrocephalus, too much spinal fluid in the brain. Coma, permanent brain damage. So in this area, I'm going to also read like everything off of those papers, but because we're already on the subject and I'm reading what I'm reading, I'm just going to say what my dad had. So my dad did go into a coma, and they said he would have permanent brain damage, but we had other doctors tell us that he didn't have brain damage. Like he did, but not like to the point where he was going to be like that for the rest of his life. And I'm not sure on the other two, because my mom didn't really want to talk about it. I tried to get as much info as I could from her, and neither did my brother, so I got as much as I could though. So I do know obviously that he did go into a coma, and he did have some brain damage. Symptoms of a ruptured brain aneurysm are nausea and vomiting, drowsiness, loss of balance such as walking, stiff neck, dilated pupils, sensitivity to light, sudden blurred or double vision, drooping eyelids, and seizures. So when my dad was getting ready for work, um, he was complaining of the blurred vision and the double vision, um, the loss of balance such as walking, because when he was walking down the hallway, he barely made it to the living room of the house that we were in, because we weren't living here, and he just fell. He had no control over it. Those are the symptoms, and you definitely, like, don't even take it lightly when somebody is having these kind of symptoms and it's severe, and it seems like something could be wrong. Take them to the emergency room fast. Don't wait a week. Don't think that it could be a sinus headache, because that's what my dad thought, because his first symptom was headache. That's what he was having. So if you are having like a severe headache and it will not go away after like taking Tylenol or ibuprofen or Advil or whatever you take for a headache, sorry, I thought I heard something. Don't take it lightly, because my dad did, and he ended up, I think if he would have went when he first, like, I mean, maybe after the second day or third day of him having this bad of a headache, I think he would have been here still, which is not his fault because he didn't know. But I'm just saying, like, if he would have went right away and they caught it sooner, he would have made it longer. And then, let's see, what else does it say? It says, although brain aneurysms usually don't show symptoms, they can press on the brain and nerves as they get bigger. See a doctor at once if you have any of the following symptoms of an unruptured aneurysm, which my dad's, I believe his ruptured, but these are some of these symptoms he had, which was a headache, and the other symptoms were dilated pupils, blurred or double vision, pain above and behind the eye, which he had the pain above and behind the eye. He didn't have drooping eyelids, and I'm not sure if he had a hard time speaking, but he didn't really talk much, so I'm going to assume he did. Weakness and numbness in one side of your face, and I believe he did have that, but I'm not sure if it was like super numb, but I do know that the symptoms that he had for sure was the nausea, vomiting. I'm reading off of this paper too. I wrote down nausea and vomiting, loss of balance walking, sensitivity to light, and sudden blurred vision. And the causes of it, well, the category was causes. But brain aneurysms usually develop as people age, becoming more common after 40, which my dad was 48, I believe my mom said, was 48. Women tend to have higher rates of aneurysms than men, and that is crazy to think about. Aneurysms tend to form at the fork of blood vessels, places where they branch off, because those sections tend to be weaker. They are most commonly found in the base of the brain. And then the next section is what increases your chances of having one. So these are things to look out for. So like if you have any of this in your family, or if you've had this happen to you, or you have this, then just make sure you look out for certain, like the headaches, the symptoms of a brain aneurysm. Just look out for those if you have this certain thing. So diseases affecting your blood or blood vessels, high blood pressure, injury or trauma to your head, infection, cancer or tumors in head and neck, abnormalities at birth such as tangled blood vessels in your brain, family history of brain aneurysms, alcohol consumption, especially binge drinking, smoking, and drug abuse. Which I'm going to tell you all of the things that my dad had from this list. He had quite a bit of the things that can increase the chances of him having one. So he did have injury or trauma to his head. It was when he was younger, but it can still lead to him having a brain aneurysm. He had the family history of a brain aneurysm because my dad's mom had one. The alcohol consumption. He drank and smoked, and he did do drugs earlier on in his life when he was younger. So that's the things that could have caused him to have one, and he didn't know it because he didn't have it checked. So the things that you can do to see if you could have a brain aneurysm or you do have one is a CT scan, which this examine creates images in your brain. You will lie on a table that slides into a CT scanner. A technician will inject contrast dye into one of your veins to make it easier to see the blood flow and spot aneurysms in your brain. Which I had a CT scan done because I'd say like wait a second. Let me try to think. I'd say like 2 years ago I had one, or a little over a year ago I had one. Not an aneurysm, but I had like a really bad headache and I couldn't open my eyes. I was just having a hard time seeing, so it was freaking me out. So I had a CT scan done, and they did inject the contrast dye. It also makes you feel like you have to pee really bad when they're doing the CT scan. And the MRI is similar to a CT scan, which that is another way of finding out. That's what they did on my dad at the hospital when he was taken. That spotted the aneurysm. I keep seeing people walk by, I think. Or at least I think I do. The MRI uses magnetic field and radio waves to create detailed images of your brain and blood vessels. MRIs and CT scans can detect aneurysms larger than 3 to 5 millimeters, which I'm not sure how big that is, but my dad's was actually pretty big. So, and another reason why it was so big was because he had it for a week before him even knowing that he had one. So the following tests are more invasive than CT or MRI scans, but they could give you and your doctors with a more complete picture of what's going on, which is an angiogram, which my dad actually had this done in the hospital after he already had the brain surgery, which is what they ended up doing, which I'm going to explain when I read my experiences from this whole thing. An angiogram, this test, considered the most reliable way to detect aneurysms, shows the weak spots in your blood vessels. During the test, you will lie on an x-ray table and you will be given something to numb any pain. Your doctor will insert a small flexible tube through a blood vessel in the leg. She will guide that tube, called a catheter, into the blood vessel in your neck that reaches the brain. She will inject a contrast dye into you, and x-rays will be taken that show all the blood vessels in the brain. This gives your doctor a map of your blood vessels, pinpointing the aneurysms. So my dad had this done. Obviously, they already found the aneurysm in his brain, but they did that angiogram. I can't even remember why they did it, but they did do that to him while he was in the hospital. Now I gotta figure out how to say this word, because this is a hard word. It's cerebral spinal fluid test, if I said that right. Your doctor may order this test if she suspects that an aneurysm may have ruptured. You'll be given something to block any pain. A technician will inject a needle into you to draw spinal fluid. That fluid is tested to see whether it contains blood, which could indicate that an aneurysm has ruptured. Treatments for a ruptured aneurysm. These are treatments that can be done, which my dad had some of this. So you need treatment as soon as possible if you have a ruptured brain aneurysm, because it's likely that it will bleed again. Treatment involves stopping the blood flow into the aneurysm. The procedures carry risks. Your doctor will figure out which treatment works best based on your health and the size, type, and location of the aneurysm. The first is a surgical clipping, which a section of your skull is removed to locate the aneurysm. A metal clip is placed on the opening of the aneurysm to cut off the blood flow. Your skull is then sealed shut, which they did they opened his brain up, which TMI, I'm sorry if there is any kids watching or anybody young watching, this might not be the best video for them to be sitting and watching, just because it can scare them maybe. I'm not really sure. I know Gabriel might be scared if he heard me talking like this, but they opened his brain from like ear to ear, and they just like flipped it this way and flipped it that way, and then that's where the brain aneurysm was. It's like right here, I would say. The next what was it, treatment was it, endovascular coiling, which they talked to my mom and my aunt about this when my mom and my aunt were there when they were trying to figure out the night before he had his surgery. This doesn't require surgery that opens the skull. Your doctor will insert a catheter into your groin to reach the affected blood vessel where the aneurysm is located. She'll send tiny platinum coils through the tube and place them inside the aneurysm. The coils conform to the shape of the aneurysm, stopping the blood flow there. This may be safer than surgical clipping, but it has a higher chance of the aneurysm bleeding again. That's probably why they didn't choose that exact treatment. They went with the brain surgery, which was the first one. What does that say? I believe it's flow diverter surgery. This option is for larger brain aneurysms in which neither clipping nor coiling would work. In this procedure, your doctor inserts a stent, usually a metal mesh, inside the artery. It becomes a wall inside the vessel to divert blood away from the aneurysm, which my dad also had that. They inserted it on this side, like in the back of his brain, because they had to shave his head because he had hair. They had to shave his head so that way they can like drain a lot of the blood that was in his brain. That is all that I got off of the website. I thought I had more, but I'm going to now read off of my experiences. When we found out my dad had an aneurysm, he had it a week prior to him being taken to the hospital. It just finally got so bad the day he was rushed to the emergency room, which is what I just explained. He was having the symptoms from it symptoms he was having from it before he found out, and after was the nausea and vomiting, the loss of balance and walking, a sensitivity to light, sudden blurred vision. His brain aneurysm led to a seduced coma that he never came out of, which he ended up going into the coma the day after he had the surgery. Well, technically it would be the day he had the surgery, because he went into surgery the 21st of August, 2013, and the next day, the 22nd, he came out of it fine. He was good, but the swelling in his brain made them take his frontal bone out, which they waited too long to take it out, so that's why he was put into a coma. So that's why my aunt and my mom blamed the doctors for my dad pretty much being the way he was after his surgery. So even though his aneurysm ruptured, he did have other symptoms that were under the category of an unruptured aneurysm, such as headaches and pain above and behind the eye, which I wanted to put that down there so I didn't forget to mention that. My dad was 48 when he had this happen to him. It happened 8 days after his birthday, which was August 12th. August 21st, he had brain surgery. And then things that he did that could have increased his chance of having it, which I mentioned when I was in that section of the reading, which was injury or trauma to the head, family history of brain aneurysm, drinking and smoking, and drug abuse. How they found out he had a brain aneurysm was they did a CT scan and an MRI and found a brain bleed. His brain bleed was more in the front of his brain. The vasospasm, which that's what I was trying to say earlier, but now I'm saying it right. Vasospasm is a vasospasms is when it reduces blood flow to the brain after the aneurysm ruptured, which caused my dad to have a procedure called an angiogram done. He also had a procedure done called the surgical clipping. And I already mentioned this, but my dad also had a procedure done to take out the frontal plate in his forehead area so that the swelling could go up and then back down easily. The swelling is actually what put him in a coma. We later found out that the doctors should have taken out the frontal bone when they first noticed the swelling, but they waited so long to do it, and that is why my dad ended up going into a coma. Which I also want to tell you guys the story about how it happened again in this video, but the video is actually really, really long, and I want to make sure that it gets uploaded and you guys see this video because this video is so important to me. And if any of you guys can, please pass this along to any of your friends, family, and any other YouTubers that may watch you, or let people know on your channel maybe that they can come and watch it and learn a little bit more. And if any of you guys have any other questions that maybe I missed in this video and you guys would like to know, let me know in the comments down below, and I will respond to your comments and questions in another video, so that way you guys can know an answer to your question. I believe that I got the gist of everything that I wanted to. I do want to tell you guys the story about how it went and the whole entire thing leading up to him passing away. I do have a video on what happened to my dad. It's like a little bit down. I believe it's called The Story About My Angel. I can't remember the name of it, but you will find it. You will know that it's the video about my dad by the title on it. Anyways, I really loved making this video. This video means a lot to me. And I hope you guys get a lot out of this video, and you guys pass this along to your loved ones, your friends, family, just anybody you guys can, just to get this awareness out there, because it is very important to watch out. I've heard so many stories recently on people having them, and some of them succeed and some of them don't. Every story is different. So please pass this along, and don't forget to subscribe to my channel and turn your post notifications on, because I will be uploading more videos. And don't forget to hit that like button and leave any comments down below of any other questions you guys have that I could have missed, or just something you guys would like to know on this subject. And I hope all of you guys have a great, let's see, what is it, Saturday. I am trying to keep track of what day it is, and Michael just fell asleep in his chair. How sweet. I'm going to show you guys really quick just because it's so cute. Anyways, I just want to thank you guys for watching my videos, and I really loved making this video, even though this is a emotional subject. Anyways, I keep seeing things from the corner of my eyes that it's making me think that somebody is walking right there. But anyways, I will talk to you guys in my next video, whatever that may be. I am uploading a vlog today also, so I'm gonna go because this video is already like 25 minutes long. So I will see you guys in my next video. Thanks for watching, guys.